So, Melissa, you're here today. How many weeks after your surgery?
It's been 6 weeks now since I've had the boot off, and then
Were you
5 weeks prior to that. So
Okay.
a total of 11 weeks.
11 weeks, okay. And so you had surgery for your plantar fasciitis, right?
Correct.
So you had heel pain for a very long time
Very
before
long time.
we decided to fix it. Because, of course we wanted to try non-surgical treatments, and I think it's very normal because we know that a lot of people are lucky enough not to have surgery.
Correct.
So at 11 weeks, what do you think? Was it worth it?
It was more than worth it. You have no idea. Completely amazing. I mean, I still have a little sensitivity, but nothing I can't tolerate. I know that comes with the healing process, but the pain that I had is gone. There's no more pain like that anymore.
So was the surgery painful? Because you had, I'm going to tell people what you had, if you don't mind. You had that Topaz Compilation Treatment, and it was done arthroscopically.
Correct.
So you have two tiny holes on each side of the heel, but you were able to walk out of the operating room. You just had to wear that boot.
Correct, yeah.
So was it like a very painful surgery? Did you have to take a lot of pain medications?
No, actually the first couple days, I first stayed in bed, like as directed, following orders for the first 24 hours. And then after that, I had very minimal issues getting up and getting around, but staying within the guidelines of what was recommended. I would only do as required. Other than that, I mean, I had very little pain. Just right coming out of the surgery, once the anesthesia started wearing off, I felt a little discomfort. They instantly fixed that, and then from there, when I got home, by the time I got home, it was fine. Very minimal pain medicine.
How long did it take you to say, okay, that was worth it?
About 24 hours.
Really?
Yeah, really. It was very sensitive and very tender at first, but after the first 24 hours of having to stay in bed, which is my biggest thing, because I'm not a bed person, that was the hardest thing, is following those orders right there. Other than that, I mean, it didn't take long to realize this was the best thing I could have ever done. Would I recommend it? Absolutely. If someone ever said to me, hey, I'm going through the same thing, what would I do? I'd be pulling your card out and saying, you need to give Dr. Wellens a call.
No, I mean, I think it makes sense because, I mean, how much longer can you take this pain? And usually it's pretty severe pain. Like,
it is.
I see a lot of people in pain. I can tell you, this is one of the most painful conditions I see.
It is. It's something that you can't even put into words. And there's no chart to tell you how it hurts or how it doesn't hurt. It's just thankful now that I'm not on that chart for the pain.
Exactly.
And it's been well worth it.
I am with you. Like, I'm a big opponent of having this surgery. I'm like, don't live with it, because I see people who have it for like 7-8 years, and they come in and they're depressed, they like gained 100 pounds, they're diabetics, hypertensive, and I'm like, really? It could have been fixed with a procedure that takes, I mean, tourniquet time on the procedure is about 15-20 minutes. So I'm with you. I know. Well, thank you so much for sharing your story with us.
Absolutely.
All right.